welcome to All Things EdTech. This is Sarita. I'm very excited to have a really distinguished guest today in this podcast, Ganesh Mani. He's an adjunct faculty member at Carnegie Mellon. He's also an investor, data, and AI expert, especially around financial services. He was also involved as a founding advisor to a company that was a pioneer in using neural nets for cancer diagnostics, which is now part of a NASDAQ-listed company. He recently wrote a very interesting article dealing with a very, current situation, which is the COVID-19 crisis. And his article was about the usage of data, as vaccine. And he sort of spoke about using data from a variety of sources, medical, social, financial, and sort of using that data to help flatten the curve and to make decisions related to pandemic management. Very glad to have you here, Professor Mani.
Happy to be here, Sarita. Thanks for having me. So the whole idea is really, when I sat down and thought about it, how can we use data in a protective way, right? People have been talking about data as crude oil, if you will, right? That's the latest metaphor folks have used. It's fueling our information economy. But with respect to pandemics, now I'm not an epidemiologist, I'm not a physician, but I come from sort of a financial risk management background. And at the same time, for the last 2-3 decades, I've been studying different aspects of data, right? We'll get into some of that as we go forward. But for this discussion, and this has been the great equalizer, right? Nobody knew, the physicians didn't know much about it. The epidemiologists knew other pandemics. And then from a societal perspective, we haven't had this sort of crisis and this sort of global crisis in our lifetime. So on the one hand, it's been a great equalizer. On the other hand, there is so much data being generated from all over the world. So the metaphor I used was maybe data can serve as an essential oil or even as a vaccine. So what that metaphor says is, what are the protective ways? How can we use data to inform some of the thinking? And really, it's two goals, right? One is to improve the health of individuals and health of society. And a twin goal is where there's a bit of a trade-off, is how do we boost prosperity, or how do we make sure if we go into lockdowns and so on, don't take away from prosperity too much.
When we talk about data, there is, of course, the collection of data, and then, there's the availability of data that, that people need to have access to. How important has it been, in this particular pandemic?
I think data has been very important for two reasons, right? So the epidemiologists had sort of a top-down model. I would call that a theoretical model, right? So they knew a little bit about transmission rates, what they sort of call the R naught, right? So if you take a disease like measles, I think with every primary infection, you can get 12 to 18 secondary infections. Now they looked at COVID-19 and said that number is roughly 2, maybe slightly above 2 and so on. But what it turns out is it depends on the region. It depends on the time nature of it. So it's not R naught, it's more RT, and I'd say it's RTR. So it's number of people infected by region within a certain time interval. And a lot of the data now that's coming out is telling us it's not, the averages don't matter, it's the super spreaders, right? There have been very many instances of super spreaders that have, so it's 20% of the infected people who have caused sort of 80% of the infections roughly. So really focusing on those super spreading events. And that actually is small data. There aren't that many of them. I think there's a blogger from a site called Quillette who had written after compiling all the super spreader events.
It's powerful for many reasons, because it's not just about using the data to sort of forecast, what the infections are going to be or even where they're going to be, right? But it's also being able to use data to then, sort of make very, very critical, strategic or tactical decisions. If we want the data to really be an effective vaccine, then, we need the data to be good, right? And, in a fast developing situation such as this, it's not necessarily so easy to get good data, right? Data that is that is timely, data that is reliable, data that is consistent, especially because now we have data from so many different sources and they're all at different levels of aggregation possibly, and different types of data. Um, do you think that we are, from a platform system, data collection perspective, do you think that these robust systems exist, or do you think we need to be investing more in building these?
No, that's an excellent question, Sarita. So, since I'm speaking to an Indian audience, let me say I think of a data science project as a trimurti, right? Triumvirate, if you will. So, it's
Mhm.
data, it's domain knowledge, and then it's the tools or the algorithm. So, in this case, the top down models that the epidemiologists have had, they're fairly simplistic. That's not where the problem is. And like you rightly pointed out, it's been on the data side. So to trust a model's prediction, you need two things, right? You need the data to be trustworthy, and then you need to make sure that have put in their domain knowledge, if you will, into
Mhm.
the model and so on. And
Mhm.
unfortunately, what's happened is the data collection, I think it applies to both India and the US. These are local health departments, and they've sort of made up their own. In the old days, it used to be farms. I think in both countries now, a lot of the paper-based stuff is there for different reasons. One may be maturity of the technology, two because of
Mhm.
privacy reasons and so on. And it's not a common schema. Not everybody is doing it the same way. I think there are states here where they're not recording the demographics, for instance, the
Mhm.
race of the deceased and so on. So those are causing major issues. They're causing major issues from a clinician standpoint because they cannot then put them in cohorts for even an observational study and so on. And then they're creating a lot of social issues because there's always this inequity which has been brought to the forefront, right? That different uh, economic segments or different
Mhm.
races or different religious groups are not being treated equally. And that all gets back to the data. I think if the data can be standardized. So this is one of the analogies. I mean, some people say this is World War III. We should have really ideally put forth a unified digital army, right? So there
Mhm.
should have been, if you will, all the healthcare leaders and policymakers, along with the politicians, sharing
Mhm.
knowledge, right? I mean,
Mhm.
the enemy is the virus. The virus is not indulging in any counter-espionage, but it's mutating. It's doing its own thing. I think this can dictate sort of the next crisis where there are regional variances, there are temporal effects, which you're talking about. In the Far East, they use data from the SARS and the MERS
Mhm.
epidemics. There
Mhm.
were institutional learnings, and that's why they were able to use it. And some of these are, you don't need a double blind study to say
Mhm.
wear a mask, right? It's like my wearing a seatbelt. So going back to testing, so it's very interesting, right? So they said individual testing is a bottleneck, but then I think folks in France and now Japan and even in the US, they've sort of figured this out. You can actually test wastewater, right? So sewage, I sort of tongue in cheek call it a quick and dirty test, if you will, right? That tells
Mhm.
you if you test the wastewater from a building or
Mhm.
from a community, and then benchmark it. It doesn't have to be accurate. So if it's going up, probably infection is on the rise. If it's going down,
Mhm.
then it's being
Mhm.
mitigated and so on. So
Mhm.
there are some very interesting ways to sort of use that data in tandem with all the other things.
Clearly, a lot of exciting work is happening, sort of literally unfolding in front of our eyes, in managing this crisis. um, how do people that are interested in data science, or even data science practitioners, how do they become part of this process?
I think it's the founder of Instagram, Kevin Systrom. He actually wrote a program. I was talking about this R naught and RT, which is sort of the
Mm.
real-time transmission estimation. So he's got GitHub code. He's got a site called RT Live, RT Live. state by state for the US. So how is that changing over time? So it's sort of an interesting site. And actually, I was telling some youngsters from India that they can take that code and then recreate it
Mm-hmm.
for the states in India, perhaps. And these
Mm.
folks may even be able to help because all the code is available. So there's been a lot of cooperation. It's a very interesting sandbox. But there are a number of second order effects, right? We also got to see some climate change related data, right? Somebody was saying from Kathmandu, they could actually see Mount Everest, right?
Mm-hmm.
When the
Yes.
when Delhi cleared up. I mean, we would never have shut down things so dramatically to collect the
Yes.
data. So some very interesting alternative data was made
Mm.
available to us. So that's one good news. But on the other side,
Mm.
there is this whole issue with scientific publishing. I don't know whether we want to get into that. There's been a tsunami of papers, and what's happened is some of these papers are getting reviewed in a matter of days and getting published, and they tend to be
Mm-hmm.
sort of small cohorts, but then they get subsumed, they get negated by papers downstream. So there is a
Mm.
major um, issue there with scientific
Mm.
publishing. Very interesting things. It's very hard to separate the wheat from the chaff. And that's a whole
Mm.
NLP data science problem. You have a crisis. It's a great equalizer. Nobody has expert knowledge, but there's a lot of data, there's a lot of information coming in. How do you
Mm.
extract reliable information, and how do you make sure this information, the reliability of the information is going to change over time? So
Time. Yes.
new protocols will come in a few weeks, but then you have
Yes.
to sunset the old information, which is not reliable.
So a lot of interesting supplementary analysis, and I think a lot of interesting ways to sort of use proxy data to find, meaningful insights.
That's right. So the financial people now for the last 2, 3 years, right? And again, I come from that world because people were trying to predict the stock market or do modeling just based on price, volume, and the published financial reports, right? And
Mhm.
folks at the active fund managers said, we're not getting alpha out of that. Let's look at alternative sources of data, right? So they called it alternative data. Now that's a fairly big field. The alternative data people over the last few years have been looking at, like you pointed out, credit card transactions, right? What are people buying, and MasterCard, Visa, they give you information relative to the same week last year. So,
Mhm.
in fact, from an airline perspective, what the TSA here that uh, do the checkpoints, so they keep track of people, they've been now publishing numbers, I think, almost daily. So they know this day last year,
Mm.
whatever, 2.5 million people went through the TSA checkpoints. And I think when I last looked at it 2 days ago, that number was about a little north of 500,000, right? So we're
Mm.
back up to about 20% in terms of airline passengers. And you're right, the phones can be tracked. Somebody else was talking about how many people are looking for directions on Apple Maps or Google Maps, right? So that
Mm.
becomes a proxy for
Yes.
people traveling and so on. So these alternative data sources, and in New Delhi, again, we now have a benchmark, right, of the air quality levels, right? So air quality will be a marker for economic activity, right? So,
Mhm.
negatively correlated. So poor air quality gets you more economic activity, right? Things like that. So I think being smart about these alternative data sources is interesting. And likewise, because the testing, we weren't testing everybody. Um, One of the key markers, you said one of your colleagues is doing some prediction. It turned out, at least in the US anyway, the hospitalization rate was actually a pretty good indicator. Hospitalizations, you can get
Mm.
you can work backwards to get the infection rate, and you can also potentially work forward if X number of people get hospitalized, whatever, right, 10-20% of those
Mm,
folks are going to
mm.
be.
But I sort of want to, talk about, this one other aspect of this entire conversation, which is around a little bit on the dangers, right? Especially around privacy, data privacy issues,
Mhm.
right? People's individual privacy, and how do you sort of balance public health requirements versus uh, in making sure that individuals' privacy is not compromised.
I think there are two elements to it. One, we've already talked about this whole data supply chain, sort of the selection, collection, what's the vintage. We've sort of talked about
Mm,
that. There are some vexing issues there, but as a country, as a region, we need to have standards, and then even countries need to share the anonymized data and so on. But to get to that, you need to peel away some of the privacy issues. I mean, there's definitely an Orwellian angle. And here there's been, not only have we had the pandemic, we've also had this a policing issue, right? So people have been
mm,
talking about whether facial recognition, right, is a good surveillance tool or not. So in general, surveillance is sort of frowned upon in democracies. Even in China, I think there's been a fair amount of backlash, much like in the public health case, right? I have a right to know. I think whether two of my neighbors are infected with COVID-19. I
mm.
may not have a right to know if they have diabetes, for instance, right? So I think as a society, we're still sort of figuring that out. So the solutions to those are, we do have technology where the humans don't have to touch the data. The data can be passed on to the next downstream use case, right? So
Mm, mm,
our phones know that you and I perhaps met for 15 minutes in a coffee shop, right? So if I get tested positive, nobody else needs to know, but our phones sort of know it. So the technology can send you a message saying somebody you spent some time with at a coffee
yes.
shop got tested
Mm,
positive.
mm.
So, do what you want. And then that data is erased, but it's being put to good use. So putting sort of
Yes, yes.
a time and a use case, a restriction envelope around data may be one solution, but it's an
Mm,
evolving. One last point on the data. I think everybody has become savvy about data and the need for using science. The one thing that hasn't been talked about much is you own your data, I own my data. I think incentives need to be provided. And if incentives are provided, people will
mm.
share their data much more freely.
Well, thank you so much, Professor Mani, and hopefully catch you again soon in one of our future podcasts.
Thank you, Sarita. You do a great job of emceeing this. And thank you, Dipto and Sushma.